You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, big topic, how to lower your blood pressure naturally. With us, we have the author of 30 Days to Natural Blood Pressure Control, Dr. David DeRose. Dr. DeRose, welcome to the program.
Great to be with you, Randy.
All right, big topic, and I know you've written a couple of books, and we're going to talk about both of them. But for people that don't know your practice and what you do, I mean, you're a syndicated radio host. Tell us about that.
It's been exciting. For the last 16 years, I've hosted a program that's now out on about 200 stations. We interview people across the spectrum talking about health, but it's especially targeted to one of the most underserved populations in America, and that is Native Americans.
Okay. And so you help people. I know you're on the show today to talk about lowering blood pressure and your new book, The Methuselah Factor. So tell me, who should read these books and how are they different?
You know, Randy, it's amazing. If you look at the subtitle to the Methuselah Factor,
okay.
It's learn how to live sharper, leaner, longer, and better in 30 days or less.
Okay.
So, I mean, you read the subtitle and people say, well, boy, I want to be sharper. I want to be, maybe leaner, trim down a few pounds. I want to live longer or better. But let me answer the question this way. There's special people groups that need to read the book. If a person is on high blood pressure, their blood pressure is not coming under control. They've got diabetes, their sugars are not well controlled. If they've got heart disease, autoimmune conditions. If someone's dealing with chronic disease, they need the Methuselah Factor because the research is crazy. The Methuselah Factor, Randy, has to do with optimizing your blood fluidity. It's the medical science of hemorrheology. Blood fluidity.
Your wife is also a medical doctor.
She actually is.
And works with the underserved communities. Mm-hmm. And I said, do you ever recommend your husband's book, his videos? Because you have a lot of videos online.
No, we got some great stuff out there. We're working in communities throughout the country, throughout the world. Just last year, we were in Romania at a big international conference. We've got people wanting to translate our books into different languages. So it's exciting to see that people throughout the world are saying, look, we can be feeling okay today, we can be performing okay, but we can be performing better. And that's what the Methuselah Factor and really 30 Days to Natural Blood Pressure Control, about the same thing.
Is that an exaggeration? I mean, could you lower somebody's blood pressure just through nutrition and some supplements in 30 days?
I'll tell you something funny. People that really understand this. I was talking with a colleague a while back, shortly after the book came out, and he said, does it really even take 30 days? And I said, no, you're right. I mean, if someone really dives into it whole hog, we see people in a week or 2 weeks, sometimes getting off their blood pressure medications, getting off their diabetes medications. So sure, it can happen sooner, but we're trying to help people on a community level with a book, not an intensive lifestyle program where they're seeing a doctor every other day.
Okay, so they get the book, but they also get a DVD program, a set of videos that go with this, and they watch a little bit of video every day, every week?
Here's how it works, Randy. If someone says, I'm a book learner, I love to read, just pick up the book, you're good to go. Other people say, I like to read it, but also listen, pick up the audiobook as well, it's on Audible. But if someone says, I want to connect with other people, we want to watch something together, with the Methuselah Factor book, we've got a DVD called Longevity Plus. It covers a lot of the same ground, but in a little different, more engaging way for people. They can dive into that and use that to complement the book as they're going through a group program. In fact, in a few weeks, I'm going to be training some people actually at a tribal health group, showing them how to use these resources. We do it in other communities as well. It's not just for Native Americans.
Okay, now we're going to talk at the second half of the program about how to lower your blood pressure naturally and possibly even wean off medications.
Powerful stuff.
Okay, but Methuselah Factor. Mm-hmm. And people need to know, look, I'm just asking the questions. I'm not necessarily endorsing you today. Mm-hmm. It's a real interview. I mean, it's your truth here. But with the Methuselah Factor, somebody with type 2 diabetes or at risk for heart disease, parents had heart disease, grandparents, whatever, they should read the book?
This is crazy. This is absolutely crazy. People today, Randy, they're concerned about their cholesterol, they're concerned about their blood pressure, their weight, they're concerned about whether or not they're smoking. All that's important. I'm not minimizing it. But you look at these blood fluidity factors, things like fibrinogen, factor 7, von Willebrand factor. People are going, what? What are you talking about? These are all things that affect blood fluidity. They are powerful factors that affect whether you're going to have a stroke or not, whether you're going to have a heart attack or not.
So you're trying to make the blood flow better, or you're trying to make the blood thinner through nutrition.
Yeah, I mean,
both.
we struggle. We struggle with the best words to use. The bottom line, hemorheology, it's the science of helping the blood flow better throughout the tiniest blood vessels, your little capillaries, so you can oxygenate your tissues better, so you can get the nutrition there, so you can remove the waste products. And what the research shows, you improve this, you decrease your risk of heart attack, you decrease your risk of stroke, you decrease your risk of blindness, you lower your risk of cancer, you decrease your risk of diabetic complications. You get the picture.
So this is all the newest cutting edge.
This is cutting edge
nutrition stuff and supplements.
It's got nutrition in it, it's
better.
got supplements, but it's also got lifestyle. It's how do you deal with stress? How do you prioritize things in life? And it gives you that key, like you said, it's the motivational component. People say, well, I know I need to be eating better. Well, how do you do it? It's in the Methuselah Factor. And we spell it out over a 30-day program.
Have you had patients, they've read the book, and they go, wow, this is a big game changer for me?
Randy, all the time we have people telling us they've read our books, they've watched the DVDs, and things are different. In fact, one person humbled me a while back. They came up to me, it was in a store, and they say, Dr. DeRose, I came to your lecture, it was 6 or 8 months ago, and it changed my life. And you say, well, why would that be humbling? Because the next words out of the guy's mouth was, but it was nothing that you said. And I'm thinking like, what's he talking about? He said it was that one graphic you showed. And he's talking about one of the graphics in our blood pressure book. And we showed how as people eat more plant foods, they decrease the risk of diabetes and high blood pressure. And that one image, so a graphic image, whether it's in a book, on a video, changed the guy's life. So let me put it this way. If you're reading through the Methuselah Factor book, you're not only helping improve your blood pressure, decrease your risk of diabetes, improve your mental performance, but you're feeling better. The kind of things that you enjoy, you're able to do more of.
You do more of, okay.
Yeah, exactly. So what we're looking at is optimizing quality of life, not just giving you a bunch of bitter pills to swallow, so at the end of the day you've got a long face and you're dragging around. That's not what health is all about. It's doing more of the things that you love and doing them better.
So this is for over 40 plus crowd, 50 plus, 70 plus?
You know,
at what age?
I'll tell you the sad thing, and this is sad. Because the people that tend to get interested in our books, the largest majority are folks that have had their 40th birthday, 50th birthday, because they're starting to realize the toll that their lifestyle has taken on their body. And I say that's sad, not because they're not getting help, but because I want more of the 30-year-olds, more of the 25-year-olds to say, listen, I could do better in the workplace. I can have that edge.
It's like a competitive edge.
That's right. I can have a competitive edge by reading the Methuselah Factor book and putting this 30-day program into practice.
Why Methuselah Factor, this title?
The reason we came up with the title Methuselah Factor is, first of all, it's the science of hemorheology. And having given
blood fluidity.
It's blood fluidity. But I give lectures on hemorheology, and someone walks out and they say, oh, that was a tremendous lecture. What was it about? It was about and they couldn't remember hemorheology. So we said, we have to come up with something memorable. How can people remember this? And we thought about that ancient figure, Methuselah. It comes out of ancient Middle Eastern literature. Actually, it's in the Bible. Methuselah was supposedly the longest lived person on this planet. So I said to myself, listen, if Methuselah lived the longest, he had to have good hemorheology. So we say, if you want to talk about hemorheology, you're talking about something Methuselah had, and that's why we call it the Methuselah Factor.
Okay. Now, a lot of medical doctors have written books about longevity, anti-aging medicine, and health. And we've talked a little bit about this.
Right.
You feel this is a little bit different. Why?
Well, it's different in many ways. In fact, I was just reading a book about longevity. It's a good book, but they didn't spell things out for people to say, here's how you can do it just day by day. And this is
good point. Okay.
So a lot of people want this. They want to say, give me something simple. Give me something in little bite-sized chunks. And the last 30 chapters of the Methuselah Factor book, they're short chapters, a few pages, 4 or 5 pages. You can read it one each day, and it gives you a simple challenge. Here's how to up your exercise program. Here's the way to eat a little bit better. So we're not saying change everything overnight, but incrementally over 30 days, you can dramatically change your lifestyle.
Have you had patients that read the book and they start weaning off their maybe diabetes, type 2 diabetes medications?
This is so important.
Or heart
this is so important you're bringing this up. If you read either of the books and you start putting those principles into practice, you have got to be working with your doctor if you're on medicines. Okay. Because we have to, really. If someone comes to a program and we use these principles, I've used them for over 30 years. We have people come into our lifestyle programs, residential programs, and from day one, I'm saying, Randy, if you come me on insulin, I'm saying we got to either stop the insulin, cut it in half, and really watch your blood sugars, because these things work. This is not just make believe.
Yeah, we've been doing the Wellness Hour TV show for 20 years.
Wow.
And my first medical doctor was on the show, was an internist like you, and he said, Randy, let me tell you about how medicine works. This was a side story, and he said, when you get placed on a medication, most patients are on that medication forever. Everybody's afraid to take them off that med. So I ask you the same thing. Is there some truth to that? Oh,
there is definitely truth in it. Today, especially when care is so fragmented, you don't want to take the person off the drug that the cardiologist
it's a liability?
It's not just that. I mean, I think there's something about, today in many practices, it is so rushed that someone says, look, if the boat is going straight, don't deviate, okay? Just stay on it. You're doing okay. You're not in the hospital. Just keep doing everything you're doing. But the problem is we keep adding medication to medication, and this is not the way we're designed to live, because every drug, Randy, every drug has side effects. You may not be having it, but someone's going to have a side effect to that medication.
But they work. Like the type 2 diabetes medications work.
Let's talk about blood pressure. The type 2 diabetes medications work. The blood pressure medications work. In chapter 3 in our book, 30 Days to Natural Blood Pressure Control, we lay out common side effects of high blood pressure medications. Urinating frequently. A lot of people say, oh, come on, who cares? I mean, I can go to the bathroom more frequently. What's the big deal? But what about lethargy, fatigue, lower energy level, lower sexual drive, depression, common symptom, cough. Some people have a worsened cough. These are common blood pressure medications, really, common symptoms. And I remember once I had a woman came into my office. She knew that we were helping people get off medications. She had high blood pressure for maybe 8 months. She'd been on 6 different drugs. Every drug she's having a side effect to, keeps going back to her doctor, switches her to a different drug, and she has a different side effect. I was thankful we were able to help her get off those medications using the kind of principles.
She's off all medications now for blood pressure.
Last I saw her. So I'm not in that practice anymore. I moved to a different area, but the point was she was able to get off her medications and do much better.
I have a lot of medical doctors that come on the program and try to say, look, Randy, I'm telling you, you could lower your blood pressure through nutrition. You can lower your chances of type 2 diabetes or reverse diabetes. He said, and they all want to write books and they haven't done it. And you've kind of laid it out like a step by step by step plan.
Yeah, a lot of people, Randy, they want to get both books, and I'll tell you why. The 30 Days to Natural Blood Pressure Control book, it lays out general principles. Okay. And for the person who likes to chart their own course, it's great for that. But we found after we released that book, there were a lot of people who said, just break it up, step by step, day by day. And as I was doing that for high blood pressure, I said, I've been lecturing about hemorrheology, about blood fluidity for years. These same principles are the principles that help blood fluidity. So when we laid out the Methuselah Factor book, what we were really doing is we're giving people tools to lower their blood pressure, to control their diabetes, to improve their heart health, to improve their lung function. You could put all these things in the equation, and here's the deal. It's simple, easy to do stuff. So yes, you're right. A lot of people say it's easy to do, but we have evidence now. In the Methuselah Factor book, we've got data about people using the blood pressure book. And what we find is, on average, if you get our DVDs and you get the book, you go through it as a group, maybe it's your church, maybe it's your business, maybe some people just around your table at home, average person with high blood pressure drops their blood pressure 17 points in the 30 days. Systolic blood pressure, diastolic, that's the lower number.
Through nutrition.
Well, it's not just nutrition. Remember, it's a social connectedness, it's stress management, it's exercise, so it's a total lifestyle program. In fact, the subtitle of the book, The No Pressure Solution, No Pressure is a Mnemonic, Nutrition, Optimal Choice of Beverages, Physical Activity, Rest, Environment, Social Support, Stress Management, Use of Natural Adjuncts. That's where those supplements come in. Okay. And then here, a lot of people say, what's that? Refraining from pressors. People are taking things that raise their blood pressure. And the last one is exercising faith in God. It's that spiritual component.
Okay, look, I told you, or I confided in you, I used to have kind of borderline high blood pressure at one point. And when you go to any store, health food store, there's a lot of stuff out there, a lot of confusion about what to take, what are the natural supplements. So you outline what supplements and the dosing in your books.
Yeah,
that you
chapter
could
12.
take.
Yeah, chapter 12 is a powerful chapter because there's all kinds of stuff out there. And Randy, I'll be honest with you. There's a lot of stuff that can lower blood pressure. But we said, what does the research show? If you look at consensus among people that are natural practitioners, and that's what we did. We looked at a number of different surveys, and we said, these are the best supplements to use. We map them out, and we talk about dosages. We talk about side effects, too, because a lot of people don't. You go on Google, and you say, oh, this is good for diabetes, ginseng. It is good for diabetes, but a lot of people don't know it raises blood pressure.
Okay.
Someone Googles depression. What do they come up with? St. John's wort. I believe in St. John's wort. It can help depression, but you know what it does to your blood pressure? It raises your blood pressure.
Is that right?
It's a pressor. So we try to give that balance in the book that people often don't get. It's not a soundbite book. So we try to look at things comprehensively, but we give things in small pieces so people can embrace it and get motivated to make change.
So the Methuselah Factor, this lifestyle book about how to get, because, and let me get this right. So when you get your, and I'm calling it circulation, but when you get this improved blood fluidity, as you call it, this hemorrheology.
Right.
When you, I guess as you get older, what, you have less blood fluidity? There's less circulation? Is this part of your theory or belief that as you get older, you slowly get less circulation?
It's not
And
just
if
my
you bring
theory.
it back, you feel better?
Yeah, it's
Younger?
not just my theory. Because typically, as we get older, our blood vessels get more stenosed. They get narrower.
Okay.
It impairs blood flow. If you improve blood flow, I mean, everything depends on blood flow. You know, I don't care what you want to talk about.
right.
You want to talk about mental function. You want to talk about sexual performance. You want to talk about physical exercise. If you can't get blood flow to your tissues in the tiny blood vessels, in fact, I got to tell you a story.
Okay.
In our book, in the Methuselah Factor, we tell the story about an orthopedic surgeon. He was a guest on my radio show, Dr. Edgar V. Meister. And he tells the story of a guy who's getting ready to have a hip replacement. And while he's getting ready, they're putting him under, he has a heart attack. Hip surgery is canceled. He ends up in the coronary care unit. The guy gets the message. He's got circulatory problems. He's going to change his lifestyle. 6 or 8 months later, when his heart is all stable, the orthopedic surgeon says, now it's time for your hip replacement. He says, you know what? My hip isn't bothering me anymore. What happened?
Yeah.
He improved his circulation. It improved his joint health. We have a chapter in the Methuselah Factor talking about arthritis.
So when blood pressure goes down, everything works better?
well,
Is that what you're saying?
it's
When you have
not
more
just-
blood fluidity,
It's blood
everything
fluidity,
gets better?
and blood pressure is part of the equation, because if your blood pressure is high, oftentimes that's an indicator that there's tightening of those small blood vessels. Maybe you're overstressed. Maybe you've got
Interesting.
disease.
So high blood pressure is a tightening, like your veins are actually getting smaller?
One thing that can raise blood pressure, I'm not going to say it's the only thing, but
Okay.
one thing that raises blood pressure is tightening those small blood vessels. So definitely, if I get you stressed out during this show, Randy, your blood pressure is going to go up. Same it with me if you stress me out.
Okay.
Yeah.
So everything in the book, if you follow it day by day, I mean, 30 days is not an exaggeration.
It's not
or
an
too big of a
exaggeration.
goal to lower it. Do you ever have people that follow the book, they use food as their medicine, they go to their traditional medical doctor, primary care physician, and the primary care physician says, I'm looking at your numbers, blood pressure's lower, how'd you do it?
I'm sure that happens, but today I'm thankful for something, Randy. In the old days, they wouldn't even often countenance lifestyle therapies. Most doctors today, they're realizing how powerful this stuff is. So it's true. We've had those, discussions.
But your wife is like a primary care
She
physician,
is,
is
she
that
is. She's a
correct?
family
And her
practice
challenge,
specialist.
like all primary care physicians, is time.
It is.
I mean, look, you had to write, 2 books on the topic. You wouldn't have that time to spend with a patient because you have to kind of change belief systems, right?
You got it.
To motivate people to do it.
You're right. And that's why we wrote the book. So a lot of my patients over the years have picked up the books and they've benefited. They tell me, they'll come in, they'll say, I read the book, I'm doing this, I've got a question, or someone else. We've got people writing in on Amazon, because the books are on Amazon, and they're saying, I lowered my blood pressure so many points, I did this, I changed my lifestyle. In fact, we just had someone called up my wife because they got our number through the radio show and said, I saw Dr. DeRose, he was speaking in Northern California at a conference. I came up to him. I said, Sonia, I'm glad that guy called. I was wondering who he was. He dropped on high blood pressure medications for years, got his numbers down. He's doing great now. Why? Because he picked up a copy of 30 Days to Natural Blood Pressure Control and started putting the principles into practice.
Now, we're short on time, but for people that are watching this, if they mention the Wellness Hour, they saw you on this program, you're going to offer some sort of a bonus. gift.
You're exactly right.
Okay.
So we've got a DVD. It's one of my most popular DVDs ever. It's called Changing Bad Habits for Good. And Randy, we'll give this as a free bonus. People buy any of the books, any of the DVDs, we'll give them that free. And the reason why I want to give it to them is because it'll change their mindset. A lot of people think, well, yeah, but I don't want to change my diet. I don't want to exercise. Once you realize that you can develop new enjoyments,
Okay.
and that's what that DVD is about, it changes the game.
So scare us a little bit, okay? Because, I told you in the green room, I said, yeah, but what if I was kind of secretly talking about myself. I said, well, what if you're, really not overweight, you exercise, and your blood pressure is just a little elevated? Why is that dangerous?
Do you know, even in ranges that we used to call normal, totally normal, even today that we call normal, you take your systolic blood pressure from 110 and raise it to 118, you increase your risk by 30% of dying of a heart attack.
So when you hear like 140 over 90, that's like a time bomb?
It's a
like
time
for
bomb.
stroke or
oh yeah,
heart attack?
every doctor that's looked at the research literature says 140 over 90. That is not adequate. But what the problem is what we find in some of the research, once you get to about 130 over 80, lowering it with medication may cause more harm than good.
Now I have a buddy, knowing you're coming on the show. He says his blood pressure is 130 over 80. He says, I'm okay.
That's not okay, Randy.
It's a dangerous situation to be in.
You're still increasing your risk of stroke and heart attack beyond what it would be if you got your systolic below 120 naturally.
So blood pressure is like one of those things you really have to watch.
You really want to keep on top of
That's
it.
like a guarantee that you have a problem if you're starting to get high blood pressure.
Let me tell you something. It's worse than this. I used to tell people a few years ago that there were only two groups of people in America: those with high blood pressure and those who were going to get it. Because the research shows that even if you're in your 50s or 60s, you don't have high blood pressure today, you live a normal lifespan, you're going to have high blood pressure before you die. But now, to be honest, I have to say there's a third group of people. And those are the people that read our book.
Okay.
Okay? So you either have high blood pressure now, or you're going to get it, or you've read 30 Days to Natural Blood Pressure Control. Of course, that's a bit tongue-in-cheek, but you get my point.
When I read your book, it's like almost like a weight loss book too. Because when you eat that way, you're also going to lose body fat.
You're exactly
right. Is that right?
What we found with the Methuselah Factor, what we find with hemorheology, if your blood is not fluid, you're going to tend to gain weight, and you're going to tend to gain more weight than if you get that blood more fluid. Improve your Methuselah Factor, lower your weight.
So Methuselah, if they're just tuning in, we're talking about one of the longest living humans in history. Is that right?
That's exactly right.
In the Bible, so you named it that way. Mm-hmm. So if you're sick, is it more for people? Because a lot of people, we were talking about men especially, we wait until we're really sick to see the doctor. And prevention is tough to sell. So when should somebody get a book like this?
We show in the Methuselah Factor how just improving your blood fluidity, whole chapter on improving cognitive performance. So if you don't want to have dementia down the road, if you want to have the mental edge, if you want to perform better, you want to get this book, you want to put the principles
So lowering
into
your
practice.
risk for type 2 diabetes, for Alzheimer's, for things like that.
For sure.
Is in the Methuselah Factor. But the lowering your blood pressure, they seem to be overlap a little bit.
Yes, because if you've got elevated blood pressure, you're increasing your risk of dementia. People don't realize
So we're
this.
talking about blood flow to the brain, blood flow to the heart, blood flow to the ankles and legs.
Exactly. That's why a lot of people want both books. They say, hey, I want these both because I'm serious about optimizing my health, and I've got high blood pressure. It runs in the family. Both books, they complement each other. Grand themes in the 30 Days to Natural Blood Pressure Control book, a lot of practical counsel, day-by-day stuff in the Methuselah Factor, and they just fit together like hand in glove.
And you have a podcast too, because I know you have the syndicated radio show.
Yeah, we've actually got video content on our website where people can go on there, and there's things that complement each chapter in the Methuselah Factor book.
Is that right? And families are doing it together.
Oh, families doing it together, business people doing it with partners, for sure.
I don't want to put words in your mouth, but do you live with this sort of a frustration that everybody doesn't get it? Like it can be easy through diet, through nutrition, through lifestyle, to get off all your medications?
You know, I don't want to say it's a frustration, but I would say it's sadness when I see a patient. I think of a couple of patients I've had. They just come right to mind. One of the guys was blind from diabetes. And when he came through and worked with us, we got his blood sugar totally under control with natural therapies. Another woman.
So you feel like if you'd have caught this person upstream a little bit,
exactly,
could have eliminated the blindness.
That's right. Or a woman with an amputation. And you see her respond dramatically to these simple things. You know, why didn't she do it before? Well, Maybe she didn't like to exercise. Can I tell you what, Randy? I don't care who you are. You lose both your legs, and you know what? You wish you could exercise now. You wished you could walk when before you said, I hate to walk. How does that happen?
So most people actually start taking care of themselves in an emergency. They
often
have the
do.
heart attack, they have the stroke, and now they go, now I'm going to start eating better.
But sometimes it's too
So
late.
that's your hard job, right?
That's the
To try
hard
to get
job.
people to eat better now.
But sometimes it's too late. That's what I'm saying. I had a patient, first time he came in to see me, he didn't think about his blood pressure, probably felt great. But I saw him 20 years after his stroke. I mean, he's paralyzed on half his body. He can hardly talk. He's in a wheelchair. I mean, it's too late to say control your blood pressure.
So it's a diet people could follow.
It's a diet people can follow. It's a lifestyle people can live with and enjoy.
What's your favorite of the two books?
Wow. They're both such great books, Randy. I mean, I didn't know that you'd ask me a question I couldn't answer, but you got me stumped.
So you like them both.
I
Should
like
they
them both.
start with the Methuselah Factor, then move on to the 30 days?
You know, if someone's got high blood pressure, definitely start with the blood pressure book.
I read the book Methuselah Factor. I didn't know it was on audio.
It is.
I like audio.
No, it's great on audio. I'm an award-winning.
And you read it?
I'm an award-winning reader. People don't know that.
Is that right?
My start in radio was actually reading. I was reading books on radio. Yeah,
So
on public radio.
It's all in there. Do you ever go off script? You're reading the book?
No. Well, I'll tell you the one interesting thing a lot of people like. We've got a lot of graphs and tables in the book. Actually, in the blood pressure book, over 100 graphs and tables. I explain them. So, because you can't see it when I'm reading the book, so I explain what the graph shows. And some people like that because they can't read the graph very well, just looking at the picture. So they say, hey, I'm reading the book, but I'm listening to the audio, and you're explaining what I'm seeing in the graphics.
You know, a lot of us know what we need to do, or at least, look, eat lean protein, low glycemic vegetables, plant-based, low carb, keto, or whatever, but we can't get ourselves to do it. And one of the things, and I'm paraphrasing you slightly, is these books are like a leverage to take action, to get you excited about eating better.
Look at them as not just giving you knowledge, but giving you the tools to translate the knowledge into practice.
Okay, good. So if they mention this program, you're going to give them an additional.
We're going to give them
when they buy the regular program.
That's right. They buy any of our resources, we'll give them free the video, Changing Bad Habits for Good. It's 2 half-hour presentations, 2 of my most popular videos ever, actually.
Okay, now, when you beg a patient to read one of the books and they read the book, what do they normally say at the end to you?
Well, you know, here's the interesting thing. If I beg a patient to read a book, usually they're not a reader, and they'll say they connect better with the audio stuff or the videos. But many people who've been skeptical going into the book, they're believers when they see the results.
And then they make their friends read it.
That's right.
And then they become health nuts, right?
Well, hopefully their enthusiasm is bridled enough that they can still live with their family.
All right, so 30 days to natural blood pressure control with your program. I want to thank you for coming on the show. So if they want to get started, they go to your website first?
Yes, compasshealth.net,
okay.
Or they can call our toll-free number, which is 844-M for Methuselah, M Factor, F-A-C-T-O-R.
Okay, good. I want to thank you for coming on the show. Good stuff.
Great to be with you,
Great
Randy.
info. You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.